Sports-related concussion is one of the most common head injuries encountered in contact and collision sports. It is important to recognize and manage sports-related concussion in a quick and timely fashion. Many athletes can return within usually a week or two, but if they have continued symptoms, that may lead to prolonged recovery and missed playing time. It is crucial to understand when an athlete is safe to return to competition. So let's discuss what a concussion is, common signs and symptoms, how we evaluate this injury, treatment, return to play decisions, and also the role of neuropsychological testing. What is a concussion? A concussion is an injury to the brain that occurs when an athlete sustains a blow or jolt to the head, face, or body. This leads to a traumatically induced alteration in brain functioning, causing both physical, cognitive, and even emotional symptoms. Contrary to popular belief, you do not need to be knocked unconscious to have sustained a concussion, and in most cases, this does not occur. Fact number one, concussions are much more common than previously recognized. Concussion is the most common head injury encountered in sports. Newer studies report up to 2 to 3 million concussions occurring each year, which is a significant increase from previous reports. It is now felt that up to 20 to 30% of high school football players sustain a concussion each season. Fact number two, concussions are difficult to recognize. You can't see a concussion. It is natural for an athlete to want to compete whenever possible. Therefore, this injury may often go unrecognized and underreported, which can be dangerous and even lead to fatal consequences. Fact number three, concussions are slower to recover in the younger athlete. New evidence suggests that not only is the young brain more vulnerable to sports-related injury, it may also take longer to recover than the adult brain. This is an important distinction because it may often take weeks for a concussion to recover completely. Fact number four, athletes who sustain a concussion are at increased risk of having further brain injury. Once you've had a concussion, you have 4 times the risk of having another, and the greatest risk to an athlete is when they return to sports while still having concussion symptoms. Fact number five, it is never safe to return to sports while still suffering from symptoms of concussion. When this occurs, athletes are placing themselves at a greater risk of repeat injury, prolonged recovery period, and possibly permanent brain injury. There are a variety of problems that may occur after a sports-related concussion, and therefore any athlete suspected of having this injury should be assessed for the following signs and symptoms. Signs that may occur just after this injury could include a vacant stare, appearing dazed or stunned, forgetting plays, answering questions very slowly, and having difficulty following conversation, mood and behavioral changes. Symptoms that the athlete may be experiencing could also include headache, dizziness, blurry vision, difficulty concentrating, or feeling very fatigued or tired. With a concussion, CAT scans and other testing are usually normal because this is a functional injury to the brain. But for injuries that may prove to be more serious, we may need to perform further testing such as CAT scan or MRI to rule out other coexisting problems or injuries. The most important aspect of treatment will be rest, which is both physical and cognitive or mental. Recovery after concussion is variable and usually occurs within 1 to 2 weeks from the injury. However, some athletes may have persistent post-concussion symptoms lasting many months. Having had a previous concussion may prolong the recovery period.
I believe my daughter woke up because...
Resting the brain means that you should avoid activity that requires a significant degree of concentration. For younger patients, that means a break from video games, iPods, and computers. Your physician will also give you a time frame to avoid physical exertion, so staying away from the gym and other outdoor sporting activities will also be a must for a certain period of time. It may also be unsafe for you to drive a vehicle because of slower reaction time. Once we have decided it is safe for you to now return to sport, we will progress you through a step-by-step program of different exercises to determine if any concussion symptoms recur. What is the role of computerized neuropsychological testing? In certain circumstances, we may ask your athlete to perform a computerized test. The Greenville Hospital System and the Stebbin Hawkins Clinic of the Carolinas have teamed up with Impact to provide an innovative software program designed to allow us to look at these injuries further. This software program is now also used widely by the NFL, NHL, Major League Soccer, and numerous high schools and colleges across the nation to provide the highest level of care for the evaluation and management of sports-related concussions. Taking good care of yourself after a concussion is essential to speedy recovery. It's important to understand about proper rest, hydration, and nutrition. Never ignore a concussion. Concussions are not just part of the game. Every head injury is a serious health concern.